Good morning. Can everyone hear me? Good morning.
Good morning.
All right. Some people make it afternoon, good evening to some people, depending on which time zone we're on. Just making sure that you can hear me. All right. We are streaming live on YouTube. Give me 1 minute, please. All right. Good morning, everyone. Again, I have muted all mics, so I will have control over opening all mics for this webinar. And my name is Hallie Brown. I am the president of the Omega Kappa chapter and your moderator for this nursing webinar. This is our fifth um, annual nursing webinar under the theme Implications of Artificial Intelligence for Nursing Practice, Education, and Research. We do have three presenters this morning that will be targeting each area of nursing practice, education, and research. Thank you all for joining us this morning. Um, and welcome. Yes. So when it comes to artificial intelligence, we in the world, we have been using it for years now, but it's becoming more and more known and more familiar, and it's more awareness is being brought to it. It's been used in different professions. It has been used in the military profession for a long time, and now we're noticing that it is trending in healthcare as well. And it has been used in healthcare for a while, but not on a broad um, spectrum as now has been, becoming the future for us to be using. We know that AI, some people love it, some people are learning to adjust to it, and some people have their, questions about it, not really liking it for numerous of reasons. So it is a trending topic that is becoming a part of nursing, and we are using it to um, integrate information, um, gather data, as well as helping to improve our outcomes, like our patient outcomes in the healthcare field. So with no further ado, I will call on Miss Alicia Baptiste to come and do our invocation before I introduce our first speaker. Alicia, you can go ahead and unmute your mic for us.
Okay, good morning and thank you, Madam President. Let us pray. Heavenly Father, we come before you. Father, we want to thank you. We want to praise your holy name. We thank you, Lord, for today that we are in the land of the living. Father, we pray at this time for this session that it will be instructive and that we will leave better informed and embraced and prepared to embrace the new trends in technology. Father, we pray for our free facilitators for clarity as they present. Father, we also pray for our president for wisdom as she continues to lead us. We pray for our many colleagues in the different countries that were affected by burial. Father, even in Jamaica, we pray for those who Lord, lost power. We continue to just present them to you, and that, Father, you will continue to be their strength, and Father, that help will be on the way for those who need the help. This we ask in your precious name. Amen.
Thank you so much for that powerful prayer, Miss Baptiste. All right. So now for our first presenter, which will be Miss Hallie Evans, Dr. Hallie Evans. I'll unmute your mic right now, Hallie. Dr. Hallie Evans is a program director for the Doctorate of Nurse Anesthesia Completion Program and Nurse Educator track at the Middle Tennessee School of Anesthesia. Her expertise includes a wide range of topics, including evidence-based practice, health and wellness, grant writing, and educating future nurse anesthesia educators in the clinical, didactic, and simulation settings, as well as curriculum planning and mapping. She serves as a professor for both the doctorate completion program and the nurse educator track. She displays her commitment to the next generation of CRNAs through innovative teaching methods and rigorous curriculum development. Dr. Evans began her career in education as a clinical preceptor, and upon earning her postmaster's doctorate, began working as a faculty at Florida International University. She has taught across the anesthesia curriculum and joined the faculty of MTSA in 2020 before becoming the program director. She is passionate about incorporating health and wellness into curriculums for students and using evidence-based techniques to educate. In addition, she believes service-based learning and giving back is a vital component to both education and wellness. Please put up your emojis and welcome Ms. Dr. Hallie Evans. Thank you so much for joining us.
Thank you. I'm so excited to be here. This is a topic I love talking about. I am going to attempt to share my screen.
You could go ahead.
Okay, and you just let me know how that's going. Can everybody?
Yes, we can see it.
Okay, so perfect. All right. Well, first of all, good morning, everyone. Thank you for the beautiful introduction. I'm Hallie Evans, and today I'll be discussing the use of AI specific to research and nursing research. We know this is such a rapidly evolving field, and understanding the benefits and the challenges and how we're using this, how we can use it better, is just crucial for anyone involved in the academic and the scientific world nowadays. All right, so what I hope to accomplish today, and this is just a brief overview, there's so much we could talk about with all of this, is to analyze the uses of AI for research and discuss the advantages of AI, the disadvantages, reflect on the ethical concerns, and then just review the best practices. If this is something you're interested in doing, how should you do it? And we'll have time for some questions and comments as well. And if you just want to, type in the chat, have you been using AI in research? And if so, how have you been using it? Or how have you seen it being used? I just kind of like to get the discussion going and see what you guys are doing or what you've seen being done as far as the use of AI. I am just, confidence is amazing. And we'll talk a little bit about that. Yes. And then there's a very similar one, Ovid synthesis, that has some capabilities like confidence, but yes. So great answer. I love that you are using that. Okay, so let me get this off the screen. Okay. So we know our brains are powerful, but so is artificial intelligence. And I and one of my co-presenter, Nicolette, that you'll meet later, Dr. Hooge, we work together and we embrace AI. We do not fight it. We look for the best ways to incorporate it into what we're doing. AI refers to machines designed to stimulate human intelligence, simulate and stimulate. I think both could be appropriate here, human intelligence. I'm going to speak to the context of research because AI can be used to apply to tasks such as data analysis, pattern recognition, predictive modeling, automation, confidence. For those of you that are familiar, we'll talk a little bit more about it, but that's like data extraction and screening articles and things like that when you are trying to write a systematic review or any integrative review, any type of paper scoping review. These applications just can significantly advance the research process. They enhance how you do things. They make it faster and more efficient. That's not to say there's not without downfalls, and we'll get to that, right? With progress always comes negatives as well. So AI uses in nursing research. When you think of AI in nursing research, I want you to kind of always think of profiling and predicting. Those are the two things it's really great at, whether it's profiling articles from a review that you're working on or predicting outcomes in true research. Those are things that it can really save time and help with when you're conducting your nursing research. In research, AI can do everything from data analysis, pattern recognition, predictive modeling, automation. We can just process information more efficiently, uncover insights that we might have missed as human beings, because, we'll talk about algorithms and how AI is trained to look at things. But AI can handle complex computations, large data sets, and it is just an invaluable asset to the field of research. Other things it can do, say you don't even know what you want to research. You can generate ideas, you can generate outlines, you can generate titles, you can generate a whole paper if you wanted, and I'm not advocating that. And we'll talk about why, but it can predict those associations, and like confidence is an example of a AI generated screening and organization system for literature reviews, but it can help you screen through all those 600 results you might get in PubMed or whatever database you're searching when you're trying to write a paper. So it is great for profiling and predicting. Those are the things that I really want to stick out in your mind. So when we talk about AI, there's different AI technologies, natural language processing. These are large language models. This is your Chat GPT. This is those things we're probably using AI even as normal people, non-nurses, whatever we need, writing a letter of recommendation, creating an outline. This is your Chat GPT, your natural language processing. Writing, it can help with answering questions, things like that. And we'll talk a little bit more about the large language models, because I think in nursing research, this is where we're starting to see it used the most, but it also has other technologies when we're doing primary research. So like deep learning, that's a method of artificial intelligence that can teaches computers to process information in the way our brain would. So that recognizes like patterns, pictures, patterns in pictures, text, sounds, other data that can be used then to produce insights and predictions. Machine learning is best for well-defined tasks with structured and labeled data. So when you think of collecting data, right, that falls right in there. And then, you know, back to deep learning, it's good for complex learning to make sense of unstructured data. So they both have a place. Machine learning solves problems through statistics and mathematics, and deep learning combines statistics and mathematics with a neural network architecture. And then when we talk about next gen AI, right, we talk about things like predictive analysis, and this can improve the insights data teams get from their data that they collect. So this will predict things based on past data, and it will just give a predictive data set. So it's not a study, it's not collected data, but it's predicting on past data. And that comes with issues of its own, which we will talk about, right? Past data can be biased, past data can be outdated. But if you want a trajectory of where things might go with your research, that's where it holds its value. You know, before, generative AI focused more on this data mining, like getting the data out from the subsets. And now we're looking more at these predictive analytics. And this can just accelerate the process so much faster. And it doesn't mean you don't have to check. And it's just one way to see what might lie ahead with your research. So I want you, sorry, let me go back, just to keep an open mind as we go through all these and just kind of think about how they might apply to what you're doing. They all have a place and they all interact with each other. And you'll hear me talk about synthetic data, and just to touch on the last slide, that synthetic data is those predictive values. So that's when you are using the predictive analysis component. It's just creating not false data, but fake data. It's not based on humans. It's just based on predicting past outcomes. So all of this works on algorithms, and you know, these algorithms are complex, and it's not that we need to be writing our own algorithms. We need to be collaborating, unless that is something you are doing, but it's necessary to have an understanding of what algorithms are. So there are a set of rules or instructions that AI follows to learn from data and make decisions. So they process, they identify patterns, and they generate outputs. In nursing research, these are important for us because they can be used for various purposes like predicting, recognition, data classification. And this will help, you know, just improve patient outcomes and quality of care, which is really what nursing research is about. We're lots of facets of nursing education, but and research, but at the end of the day, everything we're doing, if we're doing research on education or research on illness, it's to benefit patients. That's our ultimate goal. So how do these algorithms get created? The first step is to just identify the research problem. So identify the specific issue or question you want to address. Let's say you want to predict patient outcomes or identify risk factors for a disease or improve nursing workflows. You know, these algorithms and AI can help you do that. So you're going to gather and prepare your data just like you would in a normal study, collect relevant data. You know, if it's a chart review, you'll go to the clinical records, do surveys if you're doing surveys, whatever it is. And it's crucial to have this data clean, unbiased, if we're going to use AI. That's the part where we need to collaborate with our AI or help our AI to make sure that the data we're entering is the best data. So we can't rely on a computer to take out bias or to take out ethical considerations. After you prepare your data, the next thing you would do is choose the right AI technique. And common techniques are what we talked about, that machine learning, the deep learning, the natural language processing. And then you'll probably with a programmer to develop and train the algorithm. So one really interesting thing when you're using these algorithms to generate nursing research is you practice with them, right? When we do a study, maybe we do a pilot study before we do a larger study, but when we use AI to see how our data is going to run, we first enter fake data and run it that way so we can work out all the kinks and see if there's any issues, bias, ethical considerations, anything that pops up before we run our actual data. So we'll do a training and a test set. And then once we train our algorithm, it's just like a plan, do, study, act. We're going to evaluate and validate it. And we're going to see, was this accurate? Was it precise? Did it recall what we wanted it to? And then we're going to compare the algorithm's predictions with what we actually thought would happen. And once everything, all the kinks are worked out, that's when you deploy and monitor the algorithm in your research workflow. So it's not so much necessary for you to know how to write the algorithm, but it's necessary for you to know how to train it by using those practice data sets and how to recognize if there's anything wrong. So let's say we want to predict the likelihood of a patient readmission within 30 days of discharge. AI can do things like logistic regression for this purpose. And so we can predict continuous stays. We can predict the costs, associated with readmission, and that all is part of our data set and how we put things in. So there's so much we can do with this. We've just kind of tipped the iceberg as far as nursing research and the capabilities of what AI can be doing to help us. So I do want to spend a minute on large language models because I think this is how most people are using it right now in nursing. And this is that Covidence. And for those of you not familiar, Covidence is a review software. And you can search in it, you can screen in it, you can create tables in it. And if you're not using it, try it. It makes life a lot easier if you're writing a review. So if you're trying to get published, this is where AI can really, really help you. And so these large language models get trained, right? And this is how exactly what we just talked about. We gather the data, we clean the data, we split it. The algorithm gets set up and trained and checked. We see if it's usable, and then we see what we can fix. So this is kind of the process, just like research, is how you train an algorithm. So this is an example, and I'll spend a minute here. So if you see the part in yellow, these are human-driven activities of writing a literature review. And then these are things Chat GPT, and it doesn't have to be Chat GPT. I'm not product pushing here, but any LLM language model. So human efforts, and then we're going to look on the other side at the AI only, and then in the middle is the AI assisted supported. So here, the human efforts, it says, select a topic. But the truth is, AI can help you select a topic. If you're not sure what you want to do, you can nowadays ask GPT, what is a trend in nursing that I should be researching? And it'll probably pop out as many as you tell it to. So you can use AI for that. And then after you select your topic, you come up with your search terms. And again, you can ask AI, what are search terms? Give me search terms that I should be using to search this topic. And not that there shouldn't be human involvement in there. Every step, I thoroughly encourage human involvement, but it can just help you. It can make you think of things maybe you didn't. Maybe some will be good and some won't, and that's all right. But it's just a way to collaborate. And you'll see later I talk about it being a research assistant, but it can be your research assistant. It can be the not to take place of a person. We don't want to take place of people, but you can bounce your ideas off. What do you think of this search term? So use AI, collaborate with AI as much as you could, as you would with a person. Try asking it the same questions. So once you search your terms, the outline, right? And this is something that AI can help you with. Let AI help you with organization. I am a super type A person, but I can still always use help with organization when writing a paper. So let it generate the outline. It doesn't have to be the outline that you're going to use. You go back, you look at it, you say, I like this, I don't like this. And you take what you like and you leave what you don't. But AI is great for generating outlines. And then you write your review. And one other thing it can do in between is AI, Covidence, Ovid synthesis. They can put things into tables. You kind of design the table how you want it with your sample size, variables, results, all of that. And then you can start extracting the data and it will go right in there. And some of these AI literature review algorithms are so advanced that it'll start to recognize your trends and be able to help you with that. You can run AI, we have Grammarly is considered AI. All of them have those types of features. You can, after you write, you can run it back through AI to see if it improved your writing. And same thing, you take what you like and you leave what you don't. You can edit it with co-authors, but you can also edit with AI. One thing here I'd like to point out is citations. Studies that AI gives you, you have to make sure they are actual studies. I know that we've all probably heard this, but there have been studies of their own that have shown up to 70% of citations generated by AI are inaccurate. So that is one thing I really want to drive home here when you're writing your own review and doing your own, double checking that the references that they're giving you, the citations, are actually real and accurate and correct. They may be incorrect in just one capacity. They may have not pulled it from the journal it actually came from, or maybe something huge where it's a completely false citation, and that's going to reflect on you. So that is one thing. Double check, triple check, make sure they're referenced in a PubMed or a major database before you put them into any of your work. So we could spend all day on the advantages and disadvantages of AI. I'm just going to go through kind of the highlights of it. So efficiency and speed. When you hear the expression, that is not humanly possible, our brain, it's not. It is not humanly possible for us to move as fast as AI moves. So take advantage of this, but then slow it down to our human level and check everything. One of the most significant advantages of AI is its ability to increase efficiency and speed. It automates repetitive tasks like data entry, literature review, and it allows us then to focus on the more complex and creative aspects of our work. Again, it just processes large data sets faster than humans and enables quicker analysis and results. It also identifies patterns and correlations. So when you're looking for themes in your literature review or for themes in research, it might identify something that you didn't and then predict. We can look at our research and say, hey, I think from this will happen in the future, and we can use statistics to do that. But AI can also predict and forecast trends and outcomes for us. So with that, comes some reduced, you may get increased computer error, but you do also get reduced human error because it is doing some of that for you. Not to say which is better or worse. The other advantage is just that it can handle these vast amounts of information efficiently. It cuts out so much time. Again, just letting you focus on the parts that you want, the writing, the message that you really, really want to get across, anything in your research that you want to focus on more. It uncovers those hidden patterns. It's cost effective. We talk about it being your research assistant. It can be your research assistant to a point. It can reduce labor costs. And I just want to drive home, the most significant advantage is the efficiency and speed at which it moves. We cannot move as fast as AI. Disadvantages. There are lots of disadvantages. It can be a high initial investment. It comes, like we said when we were talking about algorithms, how well you put in the information, the past information to predict, or if you're using it for new research. It is completely dependent on the quality of what you put in, of the input quality. And there are lots of ethical concerns. Bias, liability, accuracy, authorship. So just to touch on a few of these, if we're using it to predict past trends and basing it on past information, there can be inherent bias with that. Also, decisions made by AI might have ethical implications that just a computer can't realize. There can be an over reliance on technology, a potential to undermine human expertise and judgment. And that's why I'm saying collaborate with AI. Don't solely depend on AI. Our brains are the most important tool we have, and we want to stay ahead of those computers and offer the things that they can't, like that ethical decision making that comes with being a human. There's some other really interesting ethical concerns. Authorship. How do you cite if you're using AI? How do you make sure the information it's giving you is accurate? How do you explain to patients that they're being treated based on an AI algorithm, right? They may not want to. They might not want to be part of a study or a treatment process that used AI. So there is a lot to think of when you're using AI in research that is beyond just the normal advantages and disadvantages of AI in general. When we talk about ethics, right, we have these principles of autonomy, non-maleficence, beneficence, and justice. And AI enhances, data analysis by using these advanced algorithms to identify patterns and correlations that might not be apparent to human researchers. It can predict these outcomes, but, let's look at if that's doing the best thing for the patient. Let's make sure always to double check with our human capabilities that this is in the best interest of the patient. To balance the pros and cons, right? We have to develop these ethical frameworks to guide the responsible use of AI in research. Ensuring high quality, unbiased data is crucial to enter for reliable AI outcomes. Continuous learning, staying up to date with AI advancements is essential to maximize the benefits and mitigate the risks of the research and ultimately to the patients. Make sure you're transparent when you're using AI. Everyone's using it. A lot of people are using it. Just be honest about it. Tell people what you used it for, what you didn't, and we'll talk a little bit more about that. But start discussions with your research group, with your writing group on the ethical components and what you guys deem as ethical versus not ethical, and where you want to stay in your boundaries of that. As a school, as a Sigma Theta Tau organization, you can come up with guidelines for yourself. It's one thing that you're not seeing across the board. We're starting to get some, especially with papers and studies, and some journals are now asking for the use of AI. I'm asking it for my students. I'm not saying don't use it. I'm saying tell me how you used it. So we just have to stay on top of the ethical concerns. Again, we just have to balance the pros and cons. And I know I just touched on this, but start to think about developing those guidelines, that what you want to use when you're writing a paper, what's acceptable to you, what's acceptable to you when you're doing a study. One of the things you can do is use different AI models to validate the validity, basically, and ensure the accuracy across data sets that you collect or across literature articles that you collect, to make sure what it's giving you is consistent across different AI platforms. And always, go back and refine, check everything that AI is giving you as far as research results or literature search screening results. Whatever it is requires another human eye on it. So these are just a couple of the consort, the consolidated standards for reporting trials of artificial intelligence, and SPIRIT is another one, the standard protocol items recommendations for interventional trials. These are now have an AI component, and they have questions for you to answer. For time's sake, I won't go through them, but they're asking authors to say how they used AI when submitting studies and papers.
2 minutes, Dr. Evans.
Yes. Sorry?
2 minutes. 2
Okay,
minutes.
thank you. I'm almost. And so I can send those to you so you can see what they look like. And then finally, say you want to use AI, what should you do? So plan your project. Planning is crucial to successfully integrating AI into your research, your literature review, however you want to do it. Determine how AI can contribute. How are you going to use it for this project? Make sure you have that mapped out from the beginning and you're choosing the right AI tools. Implementation involves several steps. Again, begin with your data collection, using databases, automated tools to gather your data, ensure quality and integrity throughout this process, because again, what you put in is going to affect what comes out. And then while AI offers many benefits, it also presents challenges. So collaborate with AI specialists to make sure ethical considerations such as data privacy, responsibility of AI must also be addressed. Informed consent, think about these things. Should we be telling participants in our study that AI was part of this study? And that answer is still being worked out, and depending what model you're following, if it's consort, they're saying yes, let them know. And then evaluate. Don't let any AI research go past you without human eyes on it. Use it. It is wonderful, but know that you are more wonderful. And all of this technology needs the human touch. And that's really where I will leave you and open it up for any questions. My virtual handshake. I have enjoyed presenting this information to you. I have a lot more on this information. If anyone's interested, please feel free to reach out. And here are some of the references. I can email you the rest, but that is the end of my presentation. So thank you.
Thank you, Dr. Evans. Really enjoyed that presentation, learned a lot. We don't necessarily use AI as much in the Bahamas. However, we are trying to get into it. I do have a workshop in Chicago next week, that I will be going over to see how I can incorporate this in our institution, because I don't work at a school, a nursing school per se, but we do have high fidelity mannequins that we want to be able to, incorporate these things to help to improve our patient outcomes with our associates at Doctors Hospital. So thank you so much for that information. We will leave the questions for last due to time. So we'll move on to our next presenter, which would be Dr. Siobhan O'Connor. Thank you so much, Dr. Evans. You can unmute your mic, Dr. O'Connor, so I'll say pull up your
Thank
biography.
you. I was going to say I've just updated my slides, if that's okay. I'll pop them
No
up now,
problem.
Leah.
No problem. All right, so Dr.
Great.
Siobhan O'Connor is a senior lecturer in the Florence Nightingale Faculty of Nursing, Midwifery, and Palliative Care at King's College London, and an adjunct associate professor at Western University, Canada. She has a multidisciplinary background with a bachelor's degree in nursing and information systems, and she has completed her PhD in health informatics and has nearly 20 years combined experience in the industry, clinical practice, and higher education. So please welcome Dr. Siobhan O'Connor.
That's great. Thanks, Leah, for the nice introduction. And I'm delighted to speak to everyone today about artificial intelligence in nursing. As she mentioned, I'm based at King's College in London, and I'm a long-standing member of Sigma Nursing. I'm in the FIMU chapter, which is one of the chapters that we have here in the UK. So for today's session, I'll just briefly introduce artificial intelligence, because it's a huge field, and talk about where AI has come from. And then I'll dive into how artificial intelligence is being used in nursing practice and how nurses can contribute to this new technological trend. Before I start, I just want to give a nod to Florence Nightingale. She's most famous for her work in infection control during the Crimean War, but she had a background in statistics before she became a nurse. And that mathematical background was really instrumental in a lot of the pioneering work that she did throughout her life, including her work on infection control. So she's often referred to as the world's first nursing informatician. And I've no doubt that if Florence were here today, she'd be the leading light in relation to AI in nursing. So starting with some background in artificial intelligence, as Hallie mentioned, it's a very big field that develops and applies advanced computational techniques to digital data. And AI has lots of different areas within it that look at aspects of human intelligence and try and mimic it using software and also hardware. So AI could look at anything from abstract reasoning to learning, decision-making, communicating, or interacting with the virtual or physical world around us, if you're maybe interested in robotics, chatbots, or gaming. There's also lots of definitions of artificial intelligence describing what it is and what it isn't. And even in the field of computer science, there's no real agreement about what AI is, because people tend to interpret it in different ways. But I quite like this description from an EU report that summarized and synthesized many definitions of AI, because it's quite detailed without being too technical. It takes into account hardware and software and the different application areas of AI. And it also talks about how AI can use symbolic rules or predictive modeling, because there are lots of different forms of artificial intelligence. It's not just one particular technique in one application area. So I think that definition is quite useful to work from, and no doubt it will change over time as AI develops and changes in the future. So artificial intelligence began way back in the 1950s after the end of the Second World War, when breakthroughs by Alan Turing and others in computing and encryption encouraged people to explore AI. And Marvin Minsky and John McCarthy, who both worked at MIT in the United States, are considered to be the founders of the field because they organized a series of meetings and then conferences in the mid-1950s and beyond that started research into AI. But it didn't really take off until much more recently because there was lots of experimentation and dead ends in the 60s, 70s, and 80s. And it wasn't until the early 1990s when advanced computational techniques like machine learning and natural language processing started to emerge. And since then, the field of AI has really been expanding rapidly. And interestingly, you'll find AI being applied in nursing as far back as the early 1990s. The example on the slide is from a nurse called Rose Harvey from Boston College in the USA. And it's one of the earliest research studies that we found when searching, but I wouldn't be surprised if there were studies going back into the 1980s as well. It's just a bit more difficult to search for research the further back you go because the language around AI has changed and various journals and conferences have come and gone. But even way back then, some nurses were really on the ball in terms of informatics, and the rest of us are just catching up 30 years later. It was also around that time that the American Nurses Association recognized informatics as a specialty area within nursing, and the ANA developed their first scope and standards of nursing informatics practice in the mid-1990s. So I wonder if this piece of research, and no doubt others, influenced that positive step in the nursing profession. So as I mentioned, there are many different areas within AI, such as fuzzy logic, expert systems, Bayesian networks, etc. But the two most popular sets of techniques are machine learning and natural language processing. So machine learning are all the algorithms that are used to learn from past data to build predictive models. And then NLP uses software techniques to understand text or voice data. And the other thing to be aware of is that AI also overlaps with neighboring fields like data science, text mining, and good old-fashioned statistics because they share some techniques in common. So it can be a little confusing and sort of messy when you start reading about AI initially because you'll probably come across those fields as well. So some colleagues and I did a systematic review to help us understand how artificial intelligence is being used in nursing, and I'll go through what we found with you. So we had 3 research questions underpinning the review, which were how involved nurses were in AI research, what areas of nursing was artificial intelligence being employed in, covering clinical practice, education, research and policy, and then what were the benefits, limitations and risks of AI. And Hallie's already mentioned quite a few, and I'll go into those in a bit more detail. We used a kind of standard approach to doing a review, developed a search strategy covering the key terms and ran those on a number of databases over 20 years. We excluded studies where AI was under development, where it was simulated, prototyped, or not applied to any real-world dataset or scenario, or where specific AI techniques were not described in some details. And then we also excluded the usual conference proceedings, thesis discussion articles, and grey literature. We did find a couple of other reviews on AI in nursing and extracted studies from those to include in ours. And it is a little bit of out of date now because we ran our search in July 2021 and we found just over 2,000 studies, and after screening ended up including 140 in the actual review. We didn't undertake any critical appraisal because the studies were quite technical in nature, and the kind of checklist that we normally use, they're for the kind of health sciences, and a lot of the studies came from engineering, computer science, so our normal critical appraisal checklist wouldn't really apply. And also because the review was non-funded, we were trying to get it done over the summer of that year in between teaching semesters, so our resources and time were limited. So instead we just ranked the studies according to the journal's impact factor as a rough proxy for quality, which I appreciate isn't a perfect metric to use. And then after extracting data, we summarized the studies in a descriptive way because most were quite technical. So any type of meta-analysis or narrative synthesis wouldn't really have worked. So it's quite a descriptive review, but hopefully it's a useful starting point to understand how AI is being employed in nursing. In terms of the results and the study characteristics, the majority of studies, not surprisingly, were conducted in the Americas, with 65 from the United States, 10 from Canada, and 2 from Brazil. Quite a few studies, 39 in total, were from the Asia Pacific region, with research groups in China, Taiwan, Japan, South Korea, Australia, and Hong Kong. There were a smaller number of studies from Europe, 21 in total from a whole range of countries, including the UK. There were 3 studies in the Middle East from Iran and Saudi Arabia. And there was one multi-center study, which included data from 9 countries, one of which was Ghana in West Africa. But other than that, as you can see on the map, there were no studies from the continent of Africa, which is a shame. As you can see, there's been a huge increase in the number of studies over the last few years across all regions of the world. Some of the algorithms do go back into the 1990s, but there are many more algorithms now, and they're much easier to apply than they were previously. And alongside that, computing power and storage capacity has increased massively during that time period as well, making AI research more doable, and there's more funding available for AI, hence the rapid increase in the number of studies over the last few years. And my guess is that trend will continue. So the study designs were primarily quantitative in nature, using retrospective cross-sectional or cohort designs, but a few studies used mixed methods or qualitative approaches. The data sets tended to come from electronic health records in hospitals. They were the most used, with a few studies using community-based data sets from care homes, universities, or home care settings. And the most common algorithms were things like decision tree, random forest, and neural networks. But there were many more algorithms reported because there's lots of computational techniques in the field of AI. So to come to our first research question was how involved nurses were in AI research. We found about 1/3 of studies were actively led by nurses who were the corresponding author, which is encouraging to see. Those not led by nurses tended to come from different disciplines such as computer science, engineering, medicine, medical informatics, and a few were led by commercial companies like Google who were active in the AI space. There were a smaller number of studies, about 7%, where nurses actively participated in the research by providing clinical expertise to validate the results of an AI model and whatever predictions it was making. Then there were a smaller number of studies, about 15%, where nurses took a more passive role in the research by providing some or all of the data set for analysis, or they assisted with the implementation or use of an AI-based technology in a healthcare setting, but they didn't actively contribute expertise to the development or validation of the AI techniques, models, or systems. So that's kind of how we differentiated between being actively or passively involved. And then in quite a few studies, nearly half, nurses did not take part in the development, implementation, or use of AI, but they could be potential future users, which is why we included those studies in the review. I won't go through specific examples, but there's a lot more detail in the published review. And just to note that the journal we published in only allowed a maximum of 50 references, so we couldn't cite all 140 studies, but we referenced as many as we could. And you'll find a summary of all the study characteristics and the DOI link for each one in the supporting files, and they're available to download from the journal website if you want to track down any. So our second research question is a bit more interesting about where AI has been applied across the nursing profession. So the vast majority of studies were related to some form of patient care, with the most common clinical areas being critical care, general nursing care, wound care, infection control, older adult care, hospital readmissions, midwifery, emergency care, and hospital discharge. About 15% of studies were related to nursing administration and management. So that was things like how AI could improve data quality or written nursing notes. And a few studies looked at how AI could predict nurse staffing in acute settings, burnout among nurses, their job performance, or levels of bullying. We only found 4 studies related to nursing education, and they used AI algorithms to predict student attrition from nursing courses, academic failure rates, graduation and completion rates. And there was one study about how nurses could learn to use an echocardiogram using AI-assisted software. And we didn't find any studies on AI being applied in the research process itself or in the policy arena. But given Haley's presentation, I'm sure there are studies now in 2024 that cover that topic. And again, there are more examples of those studies in the published review. So then our third research question focused on the benefits, limitations, and risks of artificial intelligence. And starting with the benefits, most of the studies reported potential benefits because they only developed and tested AI algorithms or gauged people's perceptions of them. They weren't actually used in the real world with practicing nurses to inform decision-making and care delivery, but the algorithms were tested on real health data sets. A very small number of studies, about 12%, actually implemented an AI-based technology in a healthcare setting that was used by nurses and reported some benefits. But the quality of those studies varied, and some had quite weak study designs, so the reported benefits are probably a bit questionable. But overall, the benefits reported, whether they were potential or actual, included increased accuracy in predicting health, education, and other outcomes, or identifying variables that would affect outcome prediction in the models that were developed. Then a few studies reported potential improvements in nursing documentation and data standards, the management of nursing staff, triaging patients, making clinical diagnoses, or monitoring patients and their environment. And again, there's more examples in the actual review. So then when we looked at the limitations of artificial intelligence, they mainly related to the quality of the data sets, which could be missing information such as details about the sociodemographic profile of the population. Some of the data sets had self-reported measures which aren't always reliable, or had clinical measures that could be different in other regions and health systems, which might reduce the accuracy of the predictive models if they were applied elsewhere. Another limitation was that alternative AI techniques could yield different results, because most studies only used 5 or 6 different algorithms, and there are many available and more being developed all the time. The retrospective nature of the datasets was another limitation, because they may not accurately predict future events, and COVID is probably a good example of that, because the initial modelling was off by 20–30%. And then a few studies mentioned that healthcare professionals still needed to interpret the results of any AI predictive model to ensure the results were clinically relevant, and that nurses should have assisted more with testing, implementing, and evaluating the AI-based technology. And again, those study examples are in the published review. And then finally, coming to the risks, there weren't actually that many risks associated with AI reported in the studies, which I was a bit surprised about. But the ones that were sort of a mix of ethical, legal, and social risks, such as the perception that AI could replace nurses or other professionals, or be used to supersede clinical decision making. There was also a concern that nurses lacked knowledge and skills in AI, and that this was a risk to its future development and use in healthcare. And a few other studies noted the lack of transparency in how some algorithms work, which is often referred to as black box AI, which could cause safety and trust issues. And then a few studies highlighted the costs involved in gathering and analysing digital data sets versus the benefits we might get from using them, because AI is very expensive. It's not a cheap solution, and we don't know if it's cost effective or not yet. But overall, there was very little reporting of the risks of artificial intelligence. And again, these are the studies that reported the risks in the review. So unfortunately, our systematic review didn't cover all the limitations and risks of artificial intelligence, because we could only report what the studies reported. But there are some good documents from the World Health Organization and the United Nations that go into a lot of detail about the ethical and governance issues to do with AI. So, for example, algorithmic bias is probably the biggest problem with AI at the moment, and it's not really an issue to do with artificial intelligence itself, but the quality of the data sets that are used to train AI models, and the lack of thought that sometimes goes into analysing digital data, because AI is really only as good as the data set it is based on. So if certain aspects of people's sociodemographic information is missing, or certain populations of patients are overrepresented or underrepresented in the data sets that are used, then the predictive model that is built is just going to reflect that. And there are several examples already of gender bias, age bias, and racial bias in healthcare and other areas of society that are being exacerbated by the use of artificial intelligence. I've just written a very small bit about algorithmic bias. It's just a short discussion article in the Nursing Outlook in case it's helpful. And so some of the key findings for the nursing profession from our review are that, firstly, nurse leaders should strengthen capacity in the workforce to collect good quality digital patient and administrative data, and ensure key nursing data sets are available to develop AI tools. This might mean advocating for more technical infrastructure, such as electronic health records and mobile ways of working to collect data at the point of care, although there is a significant cost involved in doing that, because it's not cheap or easy to introduce electronic health records and technology in big complex hospital settings. Secondly, nurse practitioners ought to seek opportunities to develop, implement, and evaluate AI-based technologies to determine their clinical utility and collaborate with colleagues in computer science and other disciplines to do that. Nurses could also become involved in AI governance to ensure these computational techniques are applied appropriately and vulnerable patient populations are not disadvantaged by the use of predictive algorithms. Our fourth recommendation then is for nurse educators to create curricula on artificial intelligence and integrate this into existing programs so that students and practicing nurses get the knowledge and skills that they need to lead and participate in AI initiatives in healthcare. And then finally, nursing scientists or researchers should conduct interdisciplinary research, examining if AI-based technologies are effective in improving patient and other outcomes to strengthen the evidence base in this emerging area. And we should also explore in depth the limitations and risks of AI to help minimize any negative impact it may have, including the impact on nurses' workload and workflow, and how to go about implementing AI-based technologies and digital tools in various clinical settings. So just to flag up that our review did have some limitations, and mainly that we didn't search the computer science or engineering databases, which would definitely throw up more studies. And as I mentioned, we didn't do any critical appraisal because we were short on time and the studies were quite technical in nature. So the strength of the evidence base in this area isn't really clear, but hopefully the review is a useful summary of AI in nursing. And although we're in the early days of AI in nursing, it is a bit further along in medicine. But the reality is that artificial intelligence is here to stay. So as nurses, we need to get more involved. I think the take-home message from our review is that we need good quality digital patient and administrative data and a lot more informatics expertise in the nursing workforce in education, research, and in clinical practice so that we can work with colleagues in computer science and other fields to test AI algorithms and, if they're effective, implement AI-based technologies to improve patient care and professional practice. So I've been trying to work on some of the recommendations from our review over the last year or so. On the education side, I've developed curricula on AI, and that will be going into our undergraduate and postgraduate programs here at King's this coming semester. I've also published a bit about AI in nursing education, including a rather controversial editorial using ChatGPT. I've also published a two-part series of articles in the Nursing Times about generative AI in nursing education. We did a SWOT analysis of the kind of strengths, weaknesses, opportunities, and threats of these novel digital tools, because we think nurses can use generative AI to create new learning opportunities for students, but also we need to be aware of the limitations and risks that these new tools pose. So I hope those articles are helpful for nurse educators and students. If you're looking for some free training on AI and data science, then we have a great online Innovation Scholars program that runs here at King's, and it's freely available to sign up for. And you can pick and choose a whole range of introductory courses, from things like how to code in Python to learning more about NLP or deep learning, etc. And the link is on the slide for that. It's all kind of self-directed, a series of videos that you can work through and some practical toolkits for the more technical topics. So all you have to do is set up an account, log in, and off you go. You don't need to be a student or staff at King's or any of its affiliated hospitals to access this educational resource. Then on the research side, I'm working with a great nursing colleague, Professor Emma Stanmore, who's based at the University of Manchester here in the UK. And she's developed an online exercise platform called Koku, and there's a mobile app version of it as well. I can never remember what the acronym stands for, but the app is for older adults to encourage physical activity to reduce their risk of falling and developing frailty. So the app has been approved by the NHS here, which is the health service in the UK, and it's been given a very good rating by Orca, which is an independent mobile app rating agency, and Koku is available to download for free from any of the app stores. It's also available in multiple languages, not just in English, and it's currently being used in many care homes in Manchester City. So along with lots of exercise videos and games on the app, there are some simple questionnaires about a person's mobility, quality of life, etc., which we're using to develop a predictive model for falls in community dwelling older adults. And then if the model is good quality, we will do some co-design with the older people who use the app to create hopefully a nice simple digital dashboard so that we can give them information on their falls risk and evidence-based strategies to prevent a fall at home or in a care home. So we have a funded PhD student working on that for the next couple of years, which is great. And then on the policy side, I've also been involved in the Phillips Eyes review, which was led by Natasha Phillips, the Chief Nursing Informatics Officer for NHS England, our National Health Service here. And that review was all about digital transformation in nursing and midwifery in our country. I was an expert on the AI and data science panel. So hopefully when this report is published, it's due hopefully the end of this year, it'll be influential in getting more investment in nursing informatics across the board, including AI stuff. So I know artificial intelligence might seem like the furthest thing from nursing, but it's not really. Historically, nurses have focused on hands. Oh, excuse me, my dog is barking. 2 seconds.
Go ahead.
Thank you very much. Sorry, I didn't realize I couldn't unmute myself, and she has finally stopped barking. As I was saying, historically, nurses have focused on hands-on care, and that will always be the core of what we do. But just like Florence, we need to use the data we collect on our patients to improve the care we deliver. And in the 21st century, the best way to do that is to collect data in a digital form and analyze it using AI and other computational techniques to understand and improve our practice and patient care. I have a slightly longer version of this presentation where I talk more in depth about machine learning and NLP. If anyone's interested, the webinar is available for free on the Sigma repository from October of last year. So that's everything from me. And feel free to drop me an email if you have any questions, or you can follow me on Twitter. And just want to say a quick thank you to Aaliyah for organising this session. I think it's great to help educate nurses about AI, and I hope you found some of that useful, and then I'm happy to take any questions.
Thank you, Dr. O'Connor. Very informative and detailed. We'll move on. We'll have questions after.
Sure.
We will move on to our next presenter, which is Dr. Nicolette Hogg. Let me find her first. I see her in my chat. Hallie, are you still there?
Hi, can you hear
Yes,
me?
is she
Okay.
change?
I'm very sorry. She was at the airport and her flight
Okay.
got changed. And so I
Okay.
will just briefly go over her presentation.
Okay. Well, let me just do her biography
Yes.
in the meantime. Dr. Nicolette Hogg, she is the assistant director for the Middle Tennessee School of Anesthesia Acute Surgical Pain Management Fellowship. In this role, she coordinates the clinical practicum, facilitates the fellowship seminar series, and organizes point of care ultrasound workshops. With 15 years of experience as a CRNA, Dr. Nicolette is actively engaged in clinical practice at the VSON, Alpine Orthopedic Surgery Center. She earns her doctorate of nursing practice from John Hopkins School of Nursing and a master's of business administration also from John Hopkins Carey Business School. Dr. Nicolette has published in peer-reviewed journals and served on the AANA Finance Committee, as well as other professional and national and regional committees. So on her behalf and in her absence, Dr. Evans will present. I'm gonna unmute you, sorry. Go ahead.
Okay, sorry, I pressed it again. So let me come here. Sorry, let me try that again. Okay. Hi, I'm sorry you have to listen to me again. I am just going to briefly go over her presentation. We work together, and we are both, as you heard me say before, big proponents of how we can incorporate this into the respective things that we're doing. Dr. Hooge and I are also, I should have mentioned, members of Sigma Theta Tau. We're in the IOTA chapter 008. And so together we've been presenting on this topic, and we just love it. It's become really a passion of ours. So I know that Sharon talked about some of the stuff we're going to talk about here, but this presentation will be more about how we are using and how you can use AI in clinical practice. I'm going to focus on here. So the objectives, we've already kind of talked about what AI is, but we want to really hone in this presentation on the benefits in clinical practice, the challenges, ethical considerations again. So the last definition I thought was so encompassing of what AI is. Let's focus on the scope and what we can use it for clinical practice. So, we want to kind of simulate human intelligence in machines. So how can that be applied to clinical practice? We can use it to help diagnose and treat, predict, like I mentioned in the research, administrative tasks, patient monitoring, and drug discovery. So as far as diagnosis and treatment, AI can analyze a vast amount of medical data to identify patterns, just like it can in research. All the same principles can be applied to clinical practice. And this can lead to earlier, maybe more accurate diagnoses, as well as personalized treatment plans tailored to individual patient needs. For predictive analytics, again, we can look at historical data of patients to see what might happen to them, helping healthcare providers, sorry, there's a bug flying, anticipate complications and intervene earlier. This all goes back to how can we use this, for non-maleficence in the patient's best interest. And this is where we can really hone in administrative efficiency. We can automate tasks such as scheduling, billing, managing electronic health records, and just reduce the burden on administrative professionals and healthcare professionals, just allowing them to focus on patient care. I don't know how it is for you at work, but so much of my day is spent dealing with other things that I feel like, 10% of my energy, not what I'm doing, goes to what I'm actually doing in front of me. And in the background, especially if you're in a managerial position, you're dealing with personalities, you're dealing with scheduling, who can work with who, and you can use AI for all of that. And then drug discovery, this kind of goes back to research, but it can analyze biological data and predict which compounds would be effective. There's just so much we can use AI for, and just reduce the time and cost involved in bringing new drugs to the market. So we talked about types of AI, and there's more than just this. We've gone through machine learning, natural processing, but robotics, and maybe you can just type in the chat. Is anyone doing robotic surgery where they work? If you work in an OR, have you seen this? It just enhances the surgical precision and rehabilitation outcomes through these assistive technologies. Surgeries that used to involve a few days stay or longer than that, or a patient being bedbound or having to wait to go to physical therapy after. robotic surgery has taken a lot of that away. You know, we can do a hysterectomy, a robotic hysterectomy, and a patient go home the next morning or later that day. They're walking around. So there's so many uses of AI in clinical practice. So machine learning is a subset of AI, and it involves the use of those algorithms, like I talked about before, and statistical models to enable computers to learn and make decisions based on data. In nursing, machine learning is being applied in various ways to improve patient care and enhance operational efficiency. And some of the ways are predictive analytics for patient outcomes. Machine learning algorithms can analyze patient data to predict outcomes, such as the likelihood of patient hospital readmission, the risk of developing certain complications during recovery. This allows nurses to implement preventative measures and tailor care plans to individual patients. We can use it for patient monitoring. Sorry. And early warning systems. So machine learning models can continuously analyze data from patient monitoring systems to detect earlier signs of deterioration. For example, like a subtle change in vital signs that may indicate sepsis or something worse happening allows nurse to intervene promptly and potentially save lives. Personal care plans. By analyzing large data sets of patient histories, treatments, and outcomes, machine learning can help develop personalized care plans. This means nurses can provide more targeted patient care based on specific needs of the patients and the condition of the patient. Fall risk assessment. This is a great use of AI. Machine learning algorithms can assess patients' risk factors for falling by analyzing factors like mobility, medication use, prior fall history, and nurses can then use this to predict the risk of fall and implement strategies to prevent falls earlier on. Medication administration. Machine learning can help optimize medication administration by predicting the best times to administer medications and the most effective dosages based on patient-specific factors. This can improve therapeutic outcomes and reduce the risk of adverse drug reactions. Workflow, we talked about this. Machine learning can analyze the workflow patterns of nursing staff to identify inefficiencies and suggest improvements. This can lead to more streamlined operations, reduced workload, and better allocation of nursing resources. One of the amazing things about AI is it learns your processes, right? That's what, the more information you give it, the more information it can spit out. So if it knows how you're spending your time, it can optimize things for you. Clinical decision support systems. Machine learning can provide nurses with evidence-based recommendations for care. For instance, CDSS can help nurses choose the most appropriate interventions for managing chronic conditions or suggest alternative treatments when standard treatment is not effective. Natural language processing, documentation. Natural language processing can assist nurses in documenting patient information more efficiently by automatically extracting relevant data from clinical notes. This reduces the time spent on paperwork and allows nurses to focus more on direct patient care. You know, think of a search feature when you're writing a paper. If you can search for something specific in the patient chart, you want to see propranolol or something every time, everything related to that, or falls. You know, imagine just searching and streamlining within the documentation what you're looking for. And then there's just all these different is being utilized. So IBM Watson Health leverages machine learning and AI to analyze vast amounts of healthcare data and provide insights for clinical decision making. It's offering solutions on oncology, genomics, patient engagement that assist healthcare providers in providing that personalized care. Google Health is using machine learning to improve various aspects of healthcare. This is diagnostic tools, predictive tools. For example, their AI algorithms have shown that high accuracy in diagnosing conditions like diabetic retinopathy and predicting patient outcomes just from the health record. And then I won't go through all of them, but the Butterfly Network. This is something near and dear to Dr. Hooge and I, for ultrasound. Ultrasound has come really huge in the practice of nurse anesthetists in the United States and everywhere, as we're putting in nerve blocks and trying to go away from opioids. And this is a personalized device that you can hook up, and it enhances image quality, making diagnostic suggestions and just to interpret images better and what to do better. So those are just a few. There's more here, and I will send the presentation so everyone can see what they're doing. But AI can really help with your patient care. Natural language processing. This is a branch of AI that focuses on the interaction between computers and human language. I touched upon this earlier, but for patient care, this is again being used to streamline documentation, support clinical decision making. And here are some examples of how it's being used. So it can transcribe and interpret clinical notes. I don't know if anyone has hopped onto a Zoom meeting or a Teams meeting and seen somebody's AI assistant hop on first that's taking notes for them. It's the same type of thing. NLP algorithms can extract, again, relevant health information from the patient records. And the monitoring, it's amazing, how it can just pick up subtle changes and just alert the nurse or the nursing assistant to then go in and check and just, if it's 30 seconds gained, if it's longer than that, every second counts. We know that. So natural language processing is probably how we're seeing it used most at this point. And then just some examples again, IBM Watson, they're analyzing clinical notes and extracting valuable insights from unstructured data. Google Health, I just will touch on again what they're doing very similar, extracting meaningful insights from medical records to improve clinical workflows. All of these companies are using it in some way, and their products are demonstrating how natural language processing is transforming nursing just by enhancing efficiency, improving patient care, and supporting clinical decision making. Robotics. We talked a little about surgical robots, but just the precision that the robot can give that we couldn't get with surgery, the smaller incisions. It's still operated by a human. We're never saying take away the human touch, but everything is focused on patient outcomes. And so the patient outcomes with this robotic techniques are just enhanced the outcomes of patients, the time to ambulation, the time spent in the hospital, all those benchmarks that we monitor on an administrative level. Telepresence robots allow nurses to remotely interact with patients. They can move around healthcare facilities. This is very futuristic, but they can allow nurses to see things through the robot. We're not there yet where I work, but I've seen them in videos and presentations, and they are amazing. Medication delivery, things like that, patient lifting and transfer robots. There's cleaning, disinfecting robots. There's so many uses that are out there that we might not be seeing in our practices, but they're available now. They exist, which is just amazing when you think my first nursing job, two of us were assigned to turning rounds. So every 2 hours, we'd stop what we were doing, and the two of us were in charge of going around the entire unit and turning each patient, every 2 hours, same thing, someone would have to cover for us. So when you think about how this can free nurses to focus on patient care, and not that turning is not patient care, but to focus on the critical things that might be happening. It's just amazing. Lost my mouse. And then the benefits, improved efficiency. I think we've talked about a ton. Just automating tasks alone. There's things humans cannot do as fast. There's things that can be done just as well by technology that frees up our time, enhanced patient care. To me, this is what it all comes down to. But just the fact of how AI can, it really excels in just analyzing these vast amounts of data, which is crucial for early detection of everything from low blood pressure to a large disease, the onset of a major disease process. It just enables early decision making, early interventions, early treatment, which can just transform patient care. And then data-driven decisions. You don't have to wonder, well, we want evidence-based practice, right? We talk about that all the time, and we can take away that, well, the last time this happened, I did this. AI can help you make a decision based on data, based on evidence, and synthesize information from various sources, the patient's record, medical literature, real-time data of what's going on, and then provide recommendations. It doesn't mean you're going to do what it says, but it means you might consider it, or it might have thought of something that you didn't. So we never want to take away the human brain. I think that is the most important takeaway point. But it may come up with something far-fetched that you're like, that is ridiculous, or you may have just totally overlooked something. And it's no different than a colleague suggesting something to you, but that colleague may be suggesting based on experience or gut intuition. And with AI, you're going to get a recommendation based on the literature that it's gathered, the real-time patient information as well. There's lots of case studies about how it's been used to treat different conditions. There's studies going on constantly to see. One of the things that's going on here with a lot of nursing PhD projects is creating these patient care algorithms to treat a specific disease process. We know the challenges and ethical considerations. We have to worry about data privacy, bias and fairness, and integration. There's challenges in adopting this into clinical workflows. It's new. With anything new, right? There's the forming, storming stages of change, and it's hard for change, and it might be hard for people to adopt this. That people might feel like they're being replaced by technology. And I say, think of, if your facility, I still work places with paper charting, and I still work places with electronic health records, and it hasn't, replaced anyone. It's just made me more able to focus on patient care, which is the ultimate goal. Here are the references, and we will send you all of those. But I just kind of, the take-home point that I think Siobhan offered all these great free ways to use AI, practice AI, learn about it. And I think the really takeaway home point here is, if you're not using it, start with ChatGPT or whatever free, ask it some questions, see how it adjusts you. Just start to get comfortable with it in your personal life, and non-nursing life, and then see, start to think, how can I incorporate this? Can I use it to write this paper? Can I use it to educate my students? Can I use it in any way in my clinical practice? But the number one thing is comfort, because a lot of people are scared of this technology, not comfortable with it. I was a late adapter in my practice. I thought, no way I can write something better than AI can, I'm not using this. I did my first outline in it and I thought, wow, why have I not been doing this? And so I never wanted to take away from the contributions of everything we do should be looked over. Everything we do with AI, needs human eyes on it, human thought on it, human ethical considerations on it. But I just hope you won't be scared of it and you'll start to incorporate it in some way, start to learn about it, start to play around with it in a safe environment, so that you can, at the end of the day, the goal is to incorporate it in ways that improve patient care. So I really thank you for your time, and sorry that you had to listen to me twice. Dr. Hooge is wonderful, but she is traveling and her flight got changed at the last minute. So I appreciate.
Thank you so much.
Yeah.
Definitely appreciate it. Any questions? If there are any questions, please raise your hand so I can open your mics and you can ask your question. You can find the raise hand emoji to ask your questions, or if any questions in the chat, let me just check. While persons are waiting to, oh boy, didn't look like there were some earlier. Not sure what happened to the history, but if you have a question, it's your chance to ask your question now. Okay, so mics are unmuted, so if you have a question, you can go ahead and unmute your mic and ask your question to Dr. Evans or Dr. O'Connor at this time. All right, it seems like there's no questions. I thought there were questions earlier, but for some reason, I can't see my chat.
You need to write your name in the video.
Pardon? Go ahead, Charles. Claire, Claire Charles, you have a question?
It's a point sound.
Yes. All right, I don't see any hands up for questions. And I don't see any pertinent.
Good morning.
Go ahead.
Yeah, just one question. I know with the AI that usually you I guess sometimes you will put data in, and then sometime I guess you will use it in this. You will speak, talk to it to give it instruction. And I know usually even now with some of the, I guess, things that you speak and act or you say, because of the different accent, that different, from forgotten where, what country you are from. And you see that what you say and what happens or what it interprets is something different. Is something that's going to be able to I guess overcome that, because you have different language, different, and when you speak,
Yeah.
I don't know if you understand what I'm saying.
No, I totally understand. So I don't know if you have if you talk to and Siri or Alexa on your phone or at home, but and look, I'm talking to mine and it's answering me. But one of the things it does is it learns you. You know what I mean? And that's what's so amazing. So it might not get you the first time, but you keep talking and saying the same thing. It's going to learn your accent and it's going to learn you and how you speak. If and of course you can always type in, but that's the adaptive nature of it is I could speak in English, or I could choose one where I can speak in Spanish too, and my Spanish accent is horrible, but it's going to learn my Spanish accent and start to recognize me and be able to. So it will hang in there with it if it's not getting your accent.
Yeah, that was one of the things. And another thing, I know that, I don't know if you heard of a study, or no, I don't know if it's a study actually, that with McDonald's, that we're using AI as we're getting orders and stuff, and they have decided to discontinue it because of the errors
Yeah.
and stuff like that.
Right. And you have to think, so what's really funny is I've been on the customer side of that, as a a mom with kids frequenting the McDonald's drive-through. But what that didn't allow is about, right? Because you have different people driving through every day, and it doesn't allow that opportunity for it to learn one voice. So when you're using AI on a personal level, it's going to learn you. And say your hospital adapts it, you'll probably have your own login, so then when you log in, it'll be familiar with your voice. But I think that was probably one of the biggest problems with McDonald's. I know I would say fries and it would put up a milkshake for me, and I'd be like, no, 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 but it never has enough time to learn me. And that's the part where you have to be patient, just like when maybe you're trying to understand what a child newly speaking is saying to you, where they repeat and repeat. That McDonald's study or issue took that away, because you have however many people with different voices driving through ordering, and it probably just overwhelmed that poor AI robot.
Thank you for your question. Any other questions?
All right, thank you.
Patterson, Bernadette, I see your mic is on mute.
Thank you. No.
Okay, someone asked a question about putting your personal information into these AI systems. How safe is that?
I don't know if Dr. O'Connor wants to answer. Okay. Not safe. I don't put personal information. Another thing, when you start to play with Chat GPT and you say, tell me about so and so, it will sometimes give you a message that says we do not supply personal information, but you're still on the web. These are still web-based, if you're using them for writing, things like that. So I can say I haven't put my personal information, just like anything. You do enter a password. It's supposed to be a secure site, but use your own judgment. I wouldn't put my social security, any identifying government numbers on it. I'm sure it has my first name, right, by this point, but personal information, I don't know what the need to put it in there would be, but I would stay away from that.
I know Dr. O'Connor had to leave. Thank you so much,
Okay.
Dr. O'Connor. Are there any other, I think there was a question on YouTube. Let me just get it. The question was asked, how can I use AI as a student?
So as a
One
student,
moment, let me get the full thing. How
okay.
can I use AI as a student and make sure it reflects me?
Okay. So, this is a whole nother a whole nother topic, but if you are using it as a student, first of all, make sure you're allowed to be using it as a student. One of the things that's happening at my school is we're coming up with just like we have an academic ethical codes, patient sign, we're coming up with a guideline for the honor code for using AI. So make sure your instructor is okay with you using it. Again, use it to generate ideas, outlines, but you do the writing. You know, that's how you make sure it sounds like you. You check the sources. You can run it through for grammatical errors and mistakes, but use it to generate ideas. And we have a form at my school where you have to say what you used AI for. And that's kind of similar to what those consort forms ask of professional writing too, is to make sure you say that you used it in this capacity to generate ideas, to generate an outline, to generate a title, to check for grammatical errors.
No,
Hello?
we have a special patient.
Hello?
Yeah,
Are there any other questions?
One other, I know they had mentioned, I mean, in the presentation about age, that is a concern. And I think that's one of the major concerns is that people think that AI would replace the human,
Don't let it.
human. That is, I think that is a real concern. Even if it doesn't replace, it would reduce the need for, you know, the amount of
So
personnel that you need in nursing. I
yeah.
think that's the man.
And I really don't think that it will, but I think the bigger problem is not using it because you're scared of that. If you have the knowledge to stay ahead and know what it's being used for and know how to contribute, you know, that's one of the reasons Dr. Hooge and I got into this topic is we don't want to be left behind with it. You know, we want to know how we will be useful if this is something that's in the future. So that's why I say learn it, embrace it, see how you can use it. But absolutely, I don't think it will. It may replace some mundane tasks. It may automate some processes, but there's always going to be that ethical decision making components, that personalized patient care. And although it can personalize patient care, I mean, there's nothing different than me looking at a patient and talking to a patient and having a conversation, you know, that AI can't replace. So really, I say learn about it, embrace it so that that does not happen to you.
Dr. Evans, question. As a nurse, working in the various areas, having different specialties, midwifery, emergency, etc., do you think AI can help us to improve our patient outcomes? Using it, um, like say you have a situation where you're not able to actually have a chance to practice on real patients, or have persons pretend like they're real patients. Do you believe this can actually help us to improve our patient outcomes?
So what do they mean by, like, if you by, I guess,
Say we have COVID, we're not probably not able to go as a student, probably not able to go
oh,
on,
as a student, yes, absolutely, you know,
or even, you know, say you need to do some CNEs, practice, upgrade, stuff like that, as even as a nurse.
yeah, I mean, I think it's doing that for us, you know, if you think about even just typing in, hey, these are the patient's vital signs, patient history, what are possible diagnoses, you know, and then you can think about it and answer it. It can generate questions for you. It can generate clinical scenarios for you. It can generate whole simulation scenarios for you. So you can answer those questions and then reference your answers with literature if you can't do it in person.
Thank you so much. Are there any other questions? Let me check the YouTube as well. Okay, so from YouTube, sorry for my background. I'm on my way. I'm in between traveling right now. So someone's asking, how can we ensure that AI is used in a positive way despite the negative impacts it has?
That's the human component, you know, checking everything that it's giving you.
How are you? I see you that day. Oh no, you know what, guys? No, right. Yeah, right. Okay.
If there's no other question, you have something else to say, Hallie? You can go ahead.
Oh, I was just going to say, you know, one of the things, and I sorry if I didn't hear the question correctly, is form, you know, get with 2 or 3 of your colleagues and talk about the negative impacts and talk about how you're going to address them. That's the main thing, is how are we not going to let this affect us in a negative way, ethically, patient privacy way, take us, what's our limits with AI where we feel ethically comfortable. And so the main thing to not let those negative consequences come in is form committees, form task forces, write guidelines, you know, things like that will help tremendously.
All right, thank you. All right, so I don't see any other questions. Thank you so much, Dr. Evans, Dr. O'Connor, as well as Dr. Hooge. Although she wasn't able to present, you still presented her information. This webinar was very informative. I enjoyed it. It enlightened me a lot about AI. Even if I'm not comfortable with it, I am able to get a better understanding of how we can incorporate it into nursing practice, into nursing education, as well as use doing research to get those outcomes and see what's going on and how we're using it around the world. Thank you so much, Dr. O'Connor. Everyone, yes, we're still, hopefully, everybody has registered, those persons on YouTube. If you want to send your name and email address personally to our chapter's email, and we don't have a problem with that. I did drop the chapter's email onto the YouTube page for you to send your information directly to us via our Gmail, which is omega.kappa.chapter560@gmail.com. So you can send your information there to receive your CNEs. We're still working on the CNEs from the last chapter webinar. We had over 600 persons. So it's taking us some time, but hopefully this process will be much more easier because you had to register before you came into the Zoom meeting today. So we should be able to get these CNE hours out more quickly than the last time, but we're still working on the ones from the last webinar. So just hold tight. We're getting to it. We haven't forgotten about you. Hopefully I can get that done by the end of August for the last webinar. So thank you, everybody. My name is Hallie Brown. I am the president of the Omega Kappa chapter. And if you would like to join our chapter, you can use that same email address, omega.kappa.chapter560@gmail.com. And we will send you the information. Just let us know that you're interested in joining the chapter, and we can send you the information that you need. But in the meantime, you can drop us a resume and let us know your interest in joining the chapter. If you are a nurse already, and if you are a student, we will need your transcript. So thank you, everybody. Take care and enjoy the rest of your day. Thank you so much, Dr. Evans. And I'd like to get those PowerPoints from you. Persons were asking for them as well.
Absolutely. I'll email them to you now. Thank you so much for having us. We love being here.
No problem. Thank you so much. Take care, everyone.